Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
Today,
Bob.
we're going to show you how to massage the Quadratus Lumborum with a
Ooh.
massage gun.
That's
Kinda
a mouthful.
Yeah, it's kind of difficult.
It's in your back, your low
Yeah,
back,
well, let's
right?
talk about it right now, Brad. The
Sure.
Quadratus Lumborum, it attaches to the iliac crest here. Then it comes up and it attaches to the 12th rib.
Yep.
And then it's got little attachments to L4, 3, 2, 1 on the transverse processes. So that'd be this one, this one, this one, this one. So it's attached like that, and you can see if that's tight, it's going to pull the rib down. It's going to even pull your back down, and kind of throw you off into an imbalance.
Is there we're going to have a diagram of this
Yes.
later in the video?
At the end of the show, I'll show you. We'll have a diagram using the smartboard.
Right, so it'll be very easy to
Very
visualize.
clear. So how do you develop a shortened QL? This is the way I did. So I tend to sleep on my left side every night.
Sure.
So do you mind, Brad,
Yep.
if I just do this once? If you sleep on the same side every night, can you see how this could get shortened? This is getting stretched out a little bit. Your slight rounded.
Right.
Especially if you have wide pelvises.
Yep, or wide shoulders, maybe.
Or wide shoulders,
Sure.
right.
Mhm.
So this could tighten up here. The other way you do it is if you tend to sit and one side more than the other. And I
Right.
do. I have to make a conscious effort not to do this. But when I'm sitting on a high stool, I tend to go like this.
Sure.
I don't know why. Maybe
Probably
it's because
stem from your childhood.
maybe it does, or maybe because it stems because I lie on my side at
Sure,
night.
right.
So I have to make it a conscious effort to.
Right,
So
right.
now this muscle, you'll see, it's kind of difficult to get to.
Yeah, it's deep. It's under a layer of the erector spinae muscles, which we can show you where they are. But yeah, we need to get at it and
Yeah.
loosen it up.
So you're going to need someone to help you on this. Although I found Brad, I could hit it myself.
Yeah, it's not real easy,
It's
though.
not really easy, no. So Brad's going to be working on this side.
Mhm.
So I want to be like this, right? Yeah. I
No,
wanna-
oh, if you want them to see me do it, you got to put your head over here, Bob.
Okay.
Yeah.
But you're going to have to go up then. You know what I'm saying? You have to go up.
Just lay down, Bob. We'll get it. Yeah, because it's your right side, right?
Yeah.
So I'm going to go down.
Oh, no, you're right.
Of course.
Yeah.
The aging process.
Yeah, the aging process.
Here, you want a pillow?
Yeah, thank you.
You want me to double it up so you
No,
get
no,
it
I'm
there?
good. I'm
Oh,
good.
You're good? Okay, it's going to fall off
Oh.
because you're almost. This table isn't made for a 6.5 footer. All right, so.
We're getting there, guys.
Now, this is one thing you won't have to worry about. You won't have to worry about the mic cable, hopefully, at home.
Yeah.
Can you see that pretty good, Mike? Mike's our camera person today. Now, I'm going to get this going. Now, you can see what we're going to use is the pointed head. There's usually 4 or 5 heads that come with. And the reason we're doing that is because we're not going to hit the spinous process of the bones at all. We're going to stay clear away from that. And then there's a bone right here, the pelvis bone. You want to stay away from that because it's going to hurt.
It
right
goes
here.
way up to here.
Yep. So it's nice to. I've got cold fingers, Bob. It's always good.
That's all right, man.
Yeah.
Colder.
I told I was doing something with my wife, and she said, "Go wash your hands and warm them up." I mean, they were clean. Anyways, so right there's a bone, and right here's bone, and the muscle is in here, but right here is that large spinous process muscle group, and we need to get
Erector spinae.
erector spinae group. Thank you. And if I go through here, I don't want to have to go through that. I'm going to go from the top, like my finger is, and kind of behind it, and start with the gun on a low setting.
Exactly. Every time you want to start on a low setting. you
Yeah.
can
So
always-
this gun has 5 settings. So I'm on number 1, and you're going to start gentle. And the person you're doing it to is always the boss. You got to listen to their feedback. It should not be painful. It should start out. I'm just gently going in here, and if I go up in here, do you feel me get to that bone, Bob?
A little bit.
Okay.
Yeah.
So I'm not going to go any further. I'm going to go in there, and I'm going to go a little deeper. You can see I'm getting into the soft tissue. It's muscle.
It actually feels good.
And that's the response. If they say, "Oh, it feels good," then you should feel comfortable. And I'm gonna take my time to learn this, so I don't go
Yep,
up too
you're
hard.
going up and down the fibers. And
Yep. Now I'm going to be getting close to that 12th rib here pretty soon, and I don't want to shake that up, unless.
Right.
How does that feel, Bob?
That feels really good.
Oh, good. So, again, I'm working it. Should I go up farther? You think?
I think you can.
Yep.
My
Just
rib is right
well,
there.
the 12th one's that little short one.
Yeah, it is.
Just tell me when I.
Yeah. No, I don't feel anything.
You're feeling okay?
Yep. Now you're probably hitting ribs.
Okay, so I went a little deeper there, so I'm going to back off, and I'm going to go in here. Tell me if I'm going too aggressive.
No, that feels good.
Okay. So I'm going to keep putting pressure on gradually, but Bob's going to continue to give me feedback on how it feels.
Yep, and I should be breathing, relaxed.
Yep.
We want to be able to allow it to get within the muscle as much as possible. And if you find a trigger point, if I let you know, you may want to linger over that for a little bit even.
So let's pretend I hit one right in here.
Right.
And it hurts. Ow. So I'm going to back off it a little bit and maybe kind of work up to it. Or if I work on it and it's tolerable by Bob, and after about 20, 30 seconds, Bob says, "Oh, that's starting to feel better now."
Right.
That means we've got that trigger point to release. On the other hand, if you get on it and it says, "Oh, it's getting worse and worse over a period of 10 or 20 seconds," then you just got to stay away from it.
Back off of it for a while.
And then work around it. Let's say your skin, and the skin will turn red like this.
Yes.
And that's okay. Which brings up the good point. If someone has sensitive or delicate skin, or there's an injury, a cut or something like that, you can't massage around that. You don't want to break up an injury.
Brad, do you mind if I just try it once?
Yeah, go ahead. Let's see. Bob's going to have a go.
I'm going to see if I can do it to myself.
Yeah, let's get your clothing out of the way.
I mean, you have to kind of know what you're doing. I mean, you have to know where the muscle is.
Yeah.
You have to find your way up. But
in some ways, you're better off doing it yourself because you know what feels good and where you're hitting it.
So, you could feel the spine, the hardness of the spine, and then work up a couple inches, and that's the spot you're going to hit.
And how long, Bob, is the longest we're not going to massage for an hour or anything like that?
I would say the first day, you probably want to do 5 minutes or so.
Yep.
And then you can always move on from there.
Right.
So
you'll get a feel for it. And that'd be, if you have good response to that and you get done with it, things feel good and it feels good for the next couple hours, maybe 5 minutes is enough. You can go a little longer next time.
Yeah, and if you want to maybe go 15 minutes eventually,
sure.
It's up to you. But
Yep.
All right, we'll show you now a little bit of the anatomy so you can see it, visualize it.
Oh, yeah. Okay. Oh, we're going to show them the.
Yeah.
Yeah. Good idea.
Okay, we're going to now demonstrate where the muscle is. And Brad, this first one is showing from a frontal view.
Right. So looking at from the front, and they're going to be right in here where Bob had mentioned earlier. But there it shows the fibers, how they run up and down, and they're deep.
Yep, and you can see how it attaches to the 12th rib here, and then it's attaching to the transverse processes of L1, 2, 3, and 4. Now, some say 5, too.
Sure.
And some say no.
It really doesn't matter.
It might be different on people, yeah.
As far as the...
See how it attaches to the pelvis here? So you can see if this muscle is tight, it can actually bend you.
Pulls you over. Yeah. And it may be subtle. You're not going to be walking around like this probably, but there may be some involvement. But I like to note that 12th rib does not wrap all the way around.
Right.
It's kind of a floating rib.
It gets cut off there.
Yep.
So must have been the one that Adam gave to Eve, or what? How's that work again?
Well, Bob, that's another video.
So all right. Remember, Brad and I can fix just about anything.
We're not going to go over there?
Oh, you want to go over here too?
Well, it just shows it from this angle.
From the back.
Right.
Again, you can see the 12th rib. You can see the pelvis. You can see the transverse processes, not very well.
And this is where that big muscle, the erector spinae muscles, go like that right over my hand. Cover over the top of it.
That's why we had to get underneath that muscle because it's a series of muscles.
Yeah, boy, that's a nice. These smart boards are quite a deal.
Yeah, they're smarter than we are.
Yeah.
So remember, we can fix just about anything
Except for
a broken heart.
right. But this
The
isn't
heart
going to
is
help.
right about there.
Yeah, we're out of the way
so we'll have
though.
to work on that.
Yeah.
So-
It's the QL has got nothing to do with the heart valve.
Yeah. All right, thanks.